Another day, another video of first aid by Best 10 Treatment OTC Medicines for Ulcers Disease. First aid by Ulcers are painful sores that can develop in the stomach lining or duodenum. These sores can cause abdominal pain, bloating, nausea, and heartburn. Fortunately, some over-the-counter OTC medications are available to help treat the symptoms of ulcers. This video will provide an overview of OTC medicines for ulcers and how they can help provide relief. It is important to note that while some OTC medications may provide temporary relief for ulcer symptoms, they do not treat the underlying condition causing the ulcer. It is important to seek medical advice and treatment for ulcers. That being said, here are 10 OTC medicines that may provide relief for ulcer symptoms. Antacids. Over-the-counter OTC medications that can be used to treat ulcers are antacids. Antacids work by neutralizing the acid in your stomach, which helps to reduce your symptoms. Examples of antacids include Maalox, Mylanta, and Pepto-Bismol. These medications are generally safe and effective when taken as directed, but it is important to read the label and follow the instructions carefully. In some cases, antacids may interact with other medications or cause side effects, so it is important to talk to your doctor before taking these medications. H2 blockers. OTC medicines for ulcers, also known as H2 blockers, are a class of medications that help reduce symptoms of ulcers. These medicines work by blocking the production of stomach acid and reducing the pain and discomfort associated with ulcers. Common H2 blockers are cimetidine, ranitidine, and famotidine. These medicines can be taken in pill form or as an oral liquid. They are generally safe and effective treatments for ulcers when taken according to the directions on the package. However, it is important to speak to a physician before taking any OTC medicine for ulcers. Proton pump inhibitors, PPIs. Over-the-counter OTC medicines for ulcers such as proton pump inhibitors, PPI, are used as a first-line treatment for ulcers. PPIs are designed to reduce the amount of acid in the stomach to help heal ulcers and to prevent further damage. PPIs are taken orally, usually once a day, for several weeks or longer. They are generally well tolerated and have few side effects. Although PPIs have been proven to be effective in treating ulcers, they should be taken only under the supervision of a healthcare professional. Bismuth subsalicylate. OTC medicines for ulcers are an effective way to treat digestive issues such as stomach ulcers. One of the most popular OTC medicines is bismuth subsalicylate. It is a combination of bismuth, a naturally occurring mineral, and salicylic acid. It works by coating the stomach and reducing irritation of the stomach lining. It is also used to treat diarrhea, nausea, heartburn, and indigestion. Bismuth subsalicylate is generally safe and well tolerated. It is important to follow the instructions on the package and not take more than directed. In rare cases, allergic reactions have been reported with this medication. Sucralfate. OTC medicines for ulcers such as sucralfate are an effective treatment for gastric and duodenal ulcers. It works by forming a protective coating over the ulcer that prevents further damage from stomach acid and helps promote healing. Sucralfate also contains aluminium, which helps reduce stomach acid production. It is recommended to take this medicine on an empty stomach at least 1 hour before or 2 hours after meals. Common side effects may include constipation, nausea, and vomiting. It is important to follow the directions on the package label carefully and contact a doctor if any severe side effects occur. Pepto-Bismol. OTC medicines for ulcers such as Pepto-Bismol can provide fast and effective relief of the symptoms associated with ulcers. It can help reduce the burning and pain associated with ulcers, as well as decrease the amount of acid in the stomach. Pepto-Bismol also helps to protect the stomach lining from further damage caused by stomach acid. This medication is available in a variety of forms, including tablets, caplets, and liquid form, making it a convenient option for treating ulcers. It is important to follow the instructions on the label when taking Pepto-Bismol, as taking too much can lead to side effects such as constipation or nausea. Gaviscon. OTC medicines for ulcers such as Gaviscon are an effective way to reduce the pain and discomfort associated with ulcers. Gaviscon works by forming a protective barrier on top of the stomach acid, which helps to reduce the irritation caused by the acid. It also helps to reduce the amount of acid produced, which can lead to a reduction in the severity of ulcer symptoms. Gaviscon is relatively safe to take in most cases, and it is available in both liquid and tablet form. It is important to follow the directions on the label when taking Gaviscon, and to make sure that you are not taking other medications that could interact with it. Ranitidine. OTC medicines for ulcers, such as ranitidine, are available to help relieve the symptoms of ulcers. Ranitidine is an H2 blocker, which means that it blocks the production of stomach acid, which can help reduce the pain and irritation of ulcers. It can also help prevent the ulcer from getting worse. While ranitidine is available over the counter, it is important to talk to a doctor before taking any medication, as it can interact with other medications and can cause side effects. Taking ranitidine can reduce the discomfort of ulcers and help them heal more quickly. Famotidine. OTC medicines for ulcers, such as ranitidine, are available to help relieve the symptoms of ulcers. Ranitidine is an H2 blocker, which means that it blocks the production of stomach acid, which can help reduce the pain and irritation of ulcers. It can also help prevent the ulcer from getting worse. While ranitidine is available over the counter, it is important to talk to a doctor before taking any medication, as it can interact with other medications and can cause side effects. Taking ranitidine can reduce the discomfort of ulcers and help them heal more quickly. Omeprazole. Over-the-counter, OTC, medicines can be an effective treatment for ulcers, with omeprazole being one of the most popular. Omeprazole is a proton pump inhibitor, PPI, that works to reduce the amount of acid produced in the stomach. This can help to reduce the pain, burning, and discomfort that can be associated with ulcers. It is taken as a pill once a day, and it is important to take it regularly to get the best results. Omeprazole can be found in the OTC section of most pharmacies and is a safe and effective option for treating ulcers. Thanks for watching.